So in the breast tissue, we have these funny flowery looking things, and that's the milk gland. So that's where milk gets made. And then when we're ready to use that milk, it gets excreted down this hollow tube called a duct. So this goes out towards the nipple. These little squares I drew right here are just what we call the duct cells. So they just line the outsides of that tube, keep the milk on the inside where it needs to be. And these duct cells are the most common place for breast cancer to happen. So what can happen is these cells can mutate. You have a cancerous cell, they can multiply. They can go up and down this duct and all the way around. But when they do your biopsy, what they're looking to see is it inside this wall right here, or has it broken through? And yours has not broken through. It has stayed inside the wall. And that's when we give it that funny word DCIS, or that funny term. And what that stands for is ductal, meaning it comes from these cells that are the duct cells. Carcinoma, that means cancer. And they use this funny Greek term called in situ, that means in place. It just means it hasn't spread anywhere. So that's the best kind of breast cancer to have. And no matter how large it is or how many tumors there are, if they all look like this, we call it a stage 0.
Okay, good.
It's non-invasive. Yep, that's great. So then the next thing they do is they take the tissue under the microscope. Let's imagine this is one cancer cell, and they stain these cells, and what they're looking for are these little receptors on the surface, and they are female hormones, estrogen and progesterone. If those are present, then part of my job is we give a medicine that blocks those hormones. We usually do that after surgery because it decreases the risk of it coming back.
Okay.
But yours doesn't have these, so you don't need any medicines from me. So what typically happens here is you have your surgery. What that surgery is going to depend on your MRI and what they see, and that's surgery can take 2 flavors. If it's a small enough tumor, it's not near anything super important, they just remove that tumor by itself. If there's multiple tumors, or if it's large enough, then they would take the whole breast. If they only take the tumor, then afterward, they're going to want to do radiation to the breast, and that's to treat the rest of the breast tissue that's left behind. Because whatever happened that caused this cancer to happen, we want to make sure that they stop that from happening anywhere else in the breast. And then the most important thing is just to keep following with those regular mammograms. And the first couple of years, they get them every 2 months on that, or every 6 months on that side.
So she will have to have something, radiation or chemo?
Not chemo. No.
Just radiation? How long is that?
Surgery and radiation. But if she has a mastectomy, if they take the whole breast away, there's no radiation.
How long is radiation usually?
It depends on which treatment they use, but at most it's 6 weeks, Monday through Friday.
And is that on this floor?
Not on this floor. It's
The windshield?
across the street. Yeah.
Okay.
Yeah. Okay. But what we should do is make an appointment for after you've had your surgery, just so we can review, make sure there's no invasive cancer, because if there is, then that changes things a little bit. Does that all make sense?
Yeah.
Okay. So I've got a handout for you right here. This is the web page where it came from, because there's more information than I printed. This is kind of the intro. But this has your diagnosis, that DCIS, those are all the words. The stage, which is 0, receptors, negative, and then a treatment plan. Right now it's surgery, plus or minus radiation. It depends on the surgery that you have, okay? So that's for you.
Now, the only problem I have is MRI. I have anxiety and panic attacks, and when they put me in there, it just feel like my mind's gonna snap, like I'm in there just...
They've already gave her medication for it.
Well, you'll have a medicine for it, but the MRI for the breast is a whole lot different than other MRI machines. They're open, and you're actually laying face down.
Oh, face down? I can do that.
That'd be perfect for you then.
They actually have holes in the machine where your breasts go into.
Okay.
And yeah, it's a whole lot different than MRIs you've probably had before. Okay.
Okay, because I can't do the laying on my back one.
Yeah, this one should be pretty comfy. All right. Well, I'm gonna put a follow-up in like 6 or 8 weeks or so.